Have you ever wondered why sex, something that's supposed to be pleasurable, can sometimes cause pain? This is a question that many people grapple with, as the phenomenon of painful sex, medically known as dyspareunia, is surprisingly common. Pain can be experienced in a variety of ways, from discomfort on the external genitalia, such as the penis, vulva, or the entrance of the vagina, to a deeper internal pain felt within the vagina, uterus, or lower pelvis. And while anyone can experience pain related to sex, it is more common for women to experience vaginal pain after intercourse than it is for men to experience penis pain. In fact, it's estimated that 3 out of 4 women will experience painful sex at some point in their lives. This staggering statistic highlights the prevalence of this issue. Now that we've established how common this issue is, let's delve into the potential causes. One common cause of painful sex is infections, such as vaginal yeast infections and urinary tract infections. Now, these infections can lead to vaginitis, a condition where the vagina becomes swollen and inflamed. This inflammation can make sexual intercourse quite uncomfortable, often leading to additional pain or a burning sensation. When it comes to a yeast infection, it's not just about the discomfort during sex. This condition also triggers symptoms like itching, a thick white discharge, and pain during urination. The good news is that yeast infections can be treated effectively with either prescription or over-the-counter antifungal medications. Urinary tract infections, on the other hand, can cause pain and burning during sex due to irritation of the infected urinary tract tissue. The usual treatment for UTIs is a course of antibiotics, which should alleviate any associated pain. Preventative measures can also be put in place, such as urinating after sex, hydrating regularly, and avoiding the use of scented products on your genitals. Remember, if you're experiencing symptoms of these infections, it's important to seek medical advice. Sexually transmitted infections, or STIs, can also lead to painful sex. The usual culprits are infections like chlamydia and gonorrhea. They cause inflammation in the vaginal area, making penetrative sex feel like a burning sensation. They can also cause abnormal discharge or painful burning while urinating. Then there's genital herpes, which can make sex painful if you have an active infection. If you have chlamydia or gonorrhea, your healthcare provider will prescribe medication to treat the infection. While there is no cure for herpes, medication can reduce your risk of transmission and painful outbreaks. The key to prevention here is protection. Using a barrier method like condoms during sex can significantly reduce your risk of contracting these STIs. So, always remember, play it safe. In all these situations, it's essential to seek medical help if you suspect you have an STI. Your healthcare provider can diagnose and treat these conditions, helping to alleviate any associated pain. Again, seeking medical help is crucial if you suspect you have an STI. Another potential cause of painful sex is pelvic inflammatory disease, or PID. This is an infection that targets the upper female reproductive organs, often as a result of untreated sexually transmitted infections like gonorrhea or chlamydia. The symptoms of PID can be quite severe and far-reaching, affecting not only sexual health but overall well-being. They include deep pelvic pain during penetrative sex, scarring, pelvic pain, and even infertility. In more severe cases, PID can lead to damage to the fallopian tubes, fever, systemic infection, and abscesses or infected pus-filled lumps. Additional symptoms might be bleeding during sex or between periods, pain while urinating, and lower abdominal pain. If you suspect that you might have PID, it's essential to see your healthcare provider as soon as possible. PID is typically treated with antibiotics, but the damage from the infection can be permanent if not addressed promptly. PID is a serious condition that requires immediate medical attention, so don't hesitate to seek help if you have any symptoms. Lastly, let's talk about vaginal sex. This can occur when there's insufficient lubrication, which can lead to unpleasant chafing during penetrative sex, resulting in vaginal soreness. This lack of lubrication can arise from various situations, such as having penetrative sex before being fully aroused, or due to hormonal changes. For instance, if you significant life events can cause hormonal shifts that This decrease can subsequently result in vaginal dryness, making sex painful. But there's good news. Solutions are available. Lubricants can provide immediate relief, making sex changes. Treatments like topical estrogen creams can help. Remember, it's important to communicate openly with your partner about what you're experiencing. And as with all these conditions, don't suffer in silence. Reach out to a healthcare provider if you're experiencing painful sex. In conclusion, painful sex is a common issue with various potential causes. From yeast and bacterial infections to sexually transmitted diseases, pelvic inflammatory disease, and vaginal dryness, there's a vast array of factors that can make sex uncomfortable. But remember, each of these conditions has potential treatments or preventative measures. Remember, there's no need to suffer in silence. Reach out to a healthcare provider if you're experiencing painful sex. They're there to help you find a solution.